But for those that don't want to inject, there is a very good alternative if used correctly.
Okay, so welcome back to the TRT and Hormone Optimization YouTube channel. And back with us, it has been a while, is Dr. Keith Nichols. Welcome back, Keith.
Good to see you, Stephen. Good to see you. Do great work there. I've been following you for a while, of course. We go back all the way back to the beginning with you, so it's good to see you. It's good to see you again.
Yeah, thanks. Same thing. I don't know if the viewers realize, but you are the one that got me started on compounded testosterone cream, and I'm still so happy for that. So thank you again.
Yes, thank you so much, and thank you for promoting it as you have. I think you've become somewhat of the European or even expert on transference cream, and I'm glad to see that. I'm glad you still like it. Still works for you. Still works for me. It still works for my patients as well. But yes, I think that probably at this point in time in the United States, probably have a little bit more experience than almost anyone with the transference cream. And thanks to you, we brought it to the forefront. And thank you for what you continue to do about showing men there is another method of delivery that works very well. That's really what it's all about. It's not that it's got to be that way. It's just another method of delivery that works quite well.
Exactly. And that leads us to the first topic of today. So let's talk about why do you prefer the cream for your men on TRT?
Well, I'll tell you, Stephen, in my practice, I use primarily two methods of delivery, and that's going to be injections or transcranial cream. Now, we all know there are other methods of delivery. I just don't find them as efficacious. And let's point out right off the bat that there is no one method of delivery that pleases everyone. 90 to 95% of men that are on injections do fine, but there's going to be 5 or 10% that we see that don't like it for whatever reason, just doesn't work for them. And the same is going to hold true for the transcranial cream. So if one method doesn't work, we just then utilize the other. Now, from a clinical standpoint, I find that a daily utilization of either cream or injections works the best. But the reality is that most men are just not going to want to inject every day for the rest of their lives. So if you have a 40-year-old man and the average lifespan for a man, let's say 78 years of age, they're really just not going to want to inject for the next 38 years daily. But if they're not going to inject daily, then I would recommend every other day, but really no less than 3 days a week. I mean, remember, the benefits come from having optimal free testosterone levels, and I don't like significant peaks and troughs. That's why I like a more stable injection frequency, because it gives me a more stable level of free testosterone. And daily injections, daily cream will give you that stable level of testosterone where there's no significant peaks and troughs, just a nice little, what we call sine wave, just a nice little sine wave. So when we compare injections to cream, well, cream is easy to do daily. It literally takes 10 seconds to apply. I timed it the other day for my patients, and it literally took me 10 seconds to apply the cream. Now, when I hear men say, oh, and you hear it all the time, Steve, oh, that's too bothersome, too time consuming. We as providers, when we hear that, I want men to understand, we hear literally two things. Number one, I don't have a real enough problem or significant enough problem that I'm willing to take 10 seconds out of my day 2 times to treat, or I'm just too lazy to do it. Either way, not a good sign that patient's going to be a really good person to treat. I try to give them an example so they understand and put it in a different perspective. Stephen, you see men and women all day long, and how often are you diagnosing melanoma?
How often?
Yeah, often. It's really not a great cancer to have, is it?
No, it's not at all.
And treatment can be quite onerous, can it not? Treatment.
Yeah, sure thing.
So, but if you took every one of those melanoma patients and you said, hey, I'm going to put your melanoma in remission, or I'm going to cure your remission or cure your cancer, but it's just going to take you 10 seconds twice a day to do. How many of those patients would say, sign me up? Every single one of them would say, sign me up, right?
Sure. So
if the problem's real enough, you'll put in the effort to make that problem a lot better. Okay. Now, the cream, of course, is just easier to travel with. I no longer have to travel with needles, syringes, and vials. So, of course, it's easy to travel with. It also won't have a negative effect on the HDL cholesterol, like sometimes injections can. And most importantly, for any given total in the same man, it raises free testosterone levels better than the injections. So if I get a level, let's just say 1,200 in a man on injections, and then 1,200 in the same man on cream, he's going to have a better free testosterone level. And that's just based on physiology. Now, this is due to the 5-alpha reductase in the skin. When you apply the cream, it raises serum DHT higher than the injections will. Now, compared to testosterone, DHT has roughly a 5 times greater binding affinity for sex hormone binding globulin. So when you increase that serum DHT, you're going to bind up that sex hormone binding globulin with the DHT, and it's going to free up testosterone. That's why it increases free testosterone levels better for any given total in the same man.
Mm-hmm.
And the party line that I say out there all the time, and you do as well, is that you have to do injections to get great levels of testosterone, and that cream doesn't work. That's not a true statement, as you know. If it didn't work, you or I would not both be on it.
Yeah.
So but you noticed I used the word testosterone therapy. Now, if we define testosterone therapy as, say, levels, just say below 2000, it works just as good, if not better, in most men than injections. I did not say every man, but in most men, it does. Now, the key is getting a compound in a facility that will independently test their products to ensure potency, and also how to use it in a very specific way, which we'll talk about again.
Mm-hmm.
Now, we can both admit that if someone wants to abuse testosterone for bodybuilding purposes, have their levels in the tens of thousands, where they're going to have to inject, because those men are injecting grams per week. But that's not what we're doing with testosterone therapy, of course. So I prescribe both injections and cream. The man gets to make his choice. But the only message that I'm trying to relay, and that you've been trying to relay for many years, is that for those that don't want to inject, there is a very good alternative if used correctly. So let's talk about how we can use it correctly to get our best levels.
Mm-hmm.
Now, I use a Topiclick dispenser. Now, why do I use Topiclick dispensers? Well, these are TSA compliant tubes. You can travel anywhere in the country or the world with these in your carry-on luggage, and no one will ever take it out at a TSA checkpoint. Okay, that's one important part of it. Do not put it in your checked luggage, because I have had some instances where patients had theirs stolen whenever their luggage was inspected and they weren't there for the inspection, like when you're traveling to different countries. So put it on your carry-on luggage. It's a TSA compliant tube. These tubes are also comfortable where you are.
Mm-hmm.
Not leave them outside in a car on a 95-degree day, or leave them outside in your car overnight during the winter. Keep them in a temperature-controlled environment that you also would be comfortable in. Now, I use a 200 milligram per gram base, as you have, so eloquently told everyone many, many times, written a book on it. Great book, by the way.
Thanks.
And, once again, I only have it compounded in the U.S. right now. I use one compounding facility because they will independently test their products. I use a very specific base. There are multiple bases men can use. Mm-hmm. And each man, maybe he may absorb one base better than the other. So there's a lipoderm base, there's a Versa base, there's the Trevus, there's, of course, HRT base. I love the HRT base. It's a vanishing cream, leaves no residue, goes in 10 seconds, as I said, and that is a timed 10 seconds. But nonetheless, different men can absorb those bases differently. I just find the HRT base is the best base all around for most men. All right.
Yeah.
Now, when it comes to application, I think it's important to tell men how to use these Topiclicks. I'll take my top off, show you the bottom of it. That's always important. Look at the bottom of your top. Wow. So let's say it starts, you're doing your dosage is 2 clicks twice a day. So if I do my 2 clicks, it comes out identical to that. We've all seen that. And I usually take your 2 fingers and remove it very cleanly. Just get it all off of there and apply it to clean, cool, dry, freshly shaven scrotum. So clean. Yes, if men are dirty and sweaty for any reason, they need to clean up first before they apply it. But you don't have to bathe or shower before the application. As you did a video on, which was very good, you can exercise afterwards. It'll increase rate of absorption. Mm-hmm. So clean, cool, and dry. Get out of the shower, dry off, and cool down first before you apply it. Do not apply it when you first get out, when there's still a lot of moisture or humidity in the room or on your body. It goes better if it goes in 10 seconds all the way in, just like putting sunscreen on your face. If you'll let your scrotal skin dry all the way up and then apply it. Now, it works best on a freshly shaven scrotum. Why? Well, when we shave, we remove hair, debris, oil, but most importantly, remove dead skin cells. So we exfoliate the skin, right, Stephen? So it really preps that skin to absorb that testosterone. It's very best. An electric razor won't work. When I'm measuring labs from men from year to year at times, sometimes there'll be a significant drop by several hundred points, 4 or 5. In every single instant, that man stops shaving. Whenever they first start, they typically do things very well, very consistent, doing it as you order. Then they kind of get complacent. A lot of them just get plain out lazy at times. We're all subject to that, me included. And when that happens, your levels are going to drop. Whenever you had your best levels, you got to continue to do what you were doing to get those levels. All right. So I recommend these 5-bladed pivoting head Gillettes with what we call flex ball technology. Funny name, but it rotates side to side, front to back, and it has 5 blades, very large surface area. I keep one for the face and one for the scrotal skin in a different color, but these work really well. So you want to apply to clean, cool, dry, freshly shaven scrotum. Shave once a day. You do not have to make a production out of shaving. You don't have to use shaving gel or cream. Your normal body soap is enough. It literally takes 20 to 30 seconds just to go over it. All right. So I like to apply the testosterone cream twice a day. Now, I find it works best for most men from a clinical standpoint. You'll hear me say this many times, for most men. That means I'm not saying every man. Okay. There are a couple of men that I have that only apply it once a day in the morning. And I've gotten 3 reasons out of all these years of using it of why they apply it just once a day. And reason number 1 is, Doc, I'm a busy man. I work 2 and 3 jobs. My schedule is so erratic. It's easy to do in the morning before I leave, but I never know when I'm going to get home. And I just forget too much. But guess what? I feel great by just doing it once a day. Can I keep doing it that way? Yes, you can. Second reason, Doc, I don't mind doing it once a day, first thing in the morning. That's easy to do. Just get up after I shower. I'll put it on. But look, I don't want to have to think about it again. I don't have to worry about it again. I'll admit it. I'm too lazy to do it twice a day, but I really feel good just doing it once a day. Can I continue? Well, of course you can. And then the third way, Doc, man, it's changed my life. My fatigue is so much better. It gives me that energy that I need to get through the day. The problem is when I apply it at night, it kind of does the same thing. Kind of stimulates me, keeps me awake, interferes with my sleep. So can I just do it once a day in the morning? Yes, you can. So those are really the 3 reasons that I have men that do it once a day. Most do it twice a day. It's important for men to understand that if you miss a dose or forget a dose, don't stress over it. Don't double up at your next dose. You're not going to feel or function any differently from missing a single dose. It just doesn't work that way. All right.
Yeah.
Now, I showed you that bottom of my top for a reason. Before men put their top back on, they should take 2 fingers and gently press on each side of that little opening. And when they do, there's going to be a little pea size that comes out. They should take that and apply it. So if their dosage is 2 clicks, it should be click, click, swipe, apply, gently press, swipe, apply. If I would not have done that, then what would have happened due to the pressure in the tube? I would have put my top on, that would have slowly leaked out and been caked in the bottom of my top. The bottom of my patient's top should look like the bottom of my top at all times. If there's any white residue in there, they just didn't get their full dose.
Mm-hmm.
Now, what men don't understand, maybe some do, and maybe some don't. But look, when that tube is empty, it's not truly empty. So what you can do when it's empty is if you will simply take an object, a little flathead screwdriver or whatever, and pry the top off, you'll see there's quite a bit of testosterone still left in the inside of this tube that you can use for several more doses. Waste not, want not, right? So I'd utilize every little bit. There's a lot of testosterone. I know you probably can't see it due to the lighting there, but there's a lot in there. It's quite a bit. And as you can see, that's quite a bit in there as well. All right. So pry your top off, use every little bit. It's like liquid gold, as we both know.
Yeah.
So, and then so a lot of people overly worry about transference. Transferring to someone or something. Now, we all need to understand that transference does require skin-to-skin contact. Now, we use the scrotal application for 2 reasons, and I will tout your videos once again. Reason number 1 is that we typically get our best levels applied to the scrotal skin because it's thin-skinned and highly vascular, as you've pointed out. Now, look, you can apply this cream anywhere that you have skin from head to toe. From head to toe, all right? But the scrotal skin typically gives us our best levels. And number 2, it actually reduces our risk of transference. Now, since transference requires skin-to-skin contact, with a scrotal application, we should have completely eliminated any risk of transference to children or animals. And of course, wash your hands after you apply it. So we're talking about our sexual partners. How do we avoid transference to them? I know of 4 easy ways. And if you know of any additional one, please let me know. But way number 1, wait 5 hours or longer after you apply it to have sexual activity. Number 2, just simply wait till after sexual activity to apply it. Number 3, at any time after you apply it, you want to avoid any risk of transference, you can simply go into the restroom, take a towel, soap, and water, and wash off the application site. Now, that brings me to point out that after you do apply it in the morning or evening, you need to try to avoid bathing, showering, or swimming for at least 4 to 5 hours after you apply it. But once again, it's okay to go work out. So if you're going to go wash this off before sexual activity and you do it too frequently in that 4 to 5 hour mark, it will affect your levels, which if you do it every now and then, it will not have any effect on your overall results. And then the fourth way, many couples are very scheduled with regard to their intimacy. So if it happens to be that night or nights that it always occurs, you do not have to apply it at all. You won't feel or function any differently. And it's important to tell men that once they start utilizing the transcranial cream, that they should sleep with some form of clothing on their lower half so as to avoid any sustained skin-to-skin contact with their significant other. Do you have any additional transference remarks there, Stephen?
No, but that's one of the comments I get very often. Well, don't use this cream, and then they also use gel in between because they don't always see the distinction between both. They say, oh, the transference. And I always say, well, since you put it on your scrotum, I guess your children, your animals don't touch that so much.
Right.
So that's no worry. And as you pointed out in the past to me, don't worry too much for transferring to your wife, because in most cases she might need a little bit of testosterone as well, right?
Well, most of our patients, of course, their wives or significant others are with us too, and of course they're on testosterone, so they don't worry about it as much, of course. But I don't really see any issues of transference in our practice because I treat a really mature population of men, and they do a fabulous job. And really, even during intercourse, there's not a lot of sustained skin-to-skin contact with that scrotum. Okay, but nonetheless, we tell people how to avoid transference, just like of course we just did.
Yeah.
All right. So when it comes to measuring levels, that can always, cause issues for some men. When I recommend measuring 5 hours after application, that is because that's the time that I found correlates best with levels and symptomatic resolution. Your physician may recommend a different time based on his own clinical experience. As you and I made a video on this a long time ago, I've measured it at every time frame. If you want a higher number, measure it at 2 to 3 hours. You want a lower number, measure it at 10 or 11 hours. There's only about a 25% decrement from peak levels at 12 hours anyway. So it's really, once again, that nice little sine wave. But nonetheless, that 5 hour mark, that's not published anywhere. That's not anything that's written in stone. It's from clinical experience. That's all that is. All right. Now, it's important when men go get levels, and this happens a lot, is you have to have consistent application for at least 2 days before your lab draw to really get good labs. What I mean by that, if a man's going to get his labs drawn on a Wednesday morning, he should apply it twice Monday, twice Tuesday, and then Wednesday morning, exactly 5 hours before his lab draw. That's what I would instruct. But clinics, go with what your doctor instructs. Okay, he's going to base his timing and his decision making on his own clinical experience. Also, men, please understand that labs are never the same. We want to be in the same ballpark. But what happens is, we've done this experiment over and over again. We've drawn a vial of blood, 2 vials of blood at the same time, and let them run the testosterone labs in the morning, and then during the afternoon run a different number. Sometimes it can vary up to 8 nanograms per deciliter, even in free testosterone. So there's going to be a variance in labs. So don't get caught up in this. It's never going to be the same number. You may luck up, and that may happen from time or two, but it'll be in the same ballpark. Let me give you another example too. Stephen, if you and I were to go get labs tomorrow, and we applied it at 6 a.m. this morning, 6 p.m., and then we got up at 6 a.m. the next morning, we applied it exactly 12 hours apart on the dot, and then we got our labs at 11 a.m., exactly 5 hours, we are going to have a number. Let's say that 3 months from now, we wanted to get repeat labs, or 6 months, or even a year. If you and I applied it at 5:30 p.m., then got up and applied it at 7:30, then we got in our labs at 12:30, we've got a completely different number.
Yeah.
So these guys, you got to focus on how you're feeling and function, your symptomatic resolution. Don't let that number dictate how you feel, because that number will differ based on your timing of application. It's not just the 5 hour application. It's, got to remember, morning labs run on top of the evening application. Evening application runs on top of the morning application, and vice versa. So you want consistent application, but even with that, those numbers are going to vary to some degree. So do not let a number dictate how you feel or function. The first thing I look at in my follow-up with my patients is the follow-up questionnaire, the symptom questionnaire. Then I'll go look at a number. If everybody's doing great, that's their number. Okay, if there's no symptoms, that's how that works. So just have consistent application, and and try to have consistent timing. And that's kind of my take on the transdermal cream as far as how to apply it and how to measure levels and how to, and another thing, I've already mentioned it early on. You're going to have a different number too if you shave or don't shave that morning when you apply it. There's going to be a difference in numbers. Take it from Stephen, who sees this all the time, as do I. We both have more experience than probably anybody in his country, ours, with using that transcranial cream. Now, I don't want anybody to take this as a negative toward injections. It's just that it's another method of delivery that can really work well for many men that just don't want to inject.
I'm sure at this point, Keith, people will start to wonder, you're going to have another number, but what number are you aiming for? I know there's no aim really, but people are going to wonder anyway. Is it 1,000 nanograms per deciliter? Is it 1,200, 1,500? What number do you aim for? People want to hear that.
They do. Now we want to, so let me explain how men's minds work once, then I'll give you that answer to that question. And then we're going to, in a little bit, we're going to take a little deeper dive into the number I'm about to give you. Okay. So I'll see some men in follow up, and you got to remember, sometimes it's that 4 or 5 inches between a man's ear that's the hardest part to treat. So I'll have men come back and they will fill out their patient questionnaire and they will feel great. Everything will be asymptomatic. They say, "Doc, I feel like $1 million. Everything's working great." What were my levels? Well, your level was 750. What? Well, wait a minute, Doc. You know what? I don't really feel good. I take it back. I don't really think about it. I'm not feeling good at all. So that you'll see that. You'll also see a man will come back, "Doc, yeah, I might feel a little bit better. Not much. I'm not doing, just a little bit. All right. I can't tell much of a difference when I started. What were my levels? 1,600. So I guess testosterone doesn't work for you, Bill. I guess what you've got going on, that's why we do a trial of testosterone therapy. We give it to you and see if you're going to improve. Well, you're saying your mental improvement, your levels are 1,600. And so I think that you should probably just entertain not utilizing testosterone." "Oh, wait a minute, Doc. Wait. Sorry about that. I misspoke. I really am feeling much better. I just didn't want to, make it as I was doing as good as I really felt because I was afraid you might, do something different, and I'm like, that's not how it works, man. You don't have to fear that number. We'll talk about why. So guys can be their own worst enemies when it comes to letting a number dictate how they feel.
Yeah.
Okay. So it's not a number that I aim for. We all, as clinicians, have a starting dose that we use, a frequency of, injecting or application. And so the question better asked, I tell my patients, I don't aim for a number, but if you were to ask me, if I had a bell-shaped curve where the majority of men sat that do their best, that come back with symptomatic resolution, markedly improved, I would say the majority of that bell-shaped curve, those men have a free testosterone of 30 to 60 or so. Okay. Now some may run a little a bit higher, some may run lower. I mean, if it's 25 and they come back and they're feel awesome, well, 25 is their number. But the majority of those patients are going to fit inside that 30 to 60 nanograms per deciliter free testosterone.
Yeah.
All right. And I'm sure you've seen the same thing. With your symptomatic resolution, you sat right there. With my symptom resolution, I sat right there. All right.
Yeah.
But remember, don't aim for that number because every man has a different androgen receptor sensitivity. Some men make a little bit go a long way. I wish I was one of those men. Some men make a lot go a little ways. So you just have to base it on symptomatic improvement and not aim for a specific number.